Hey folks, how you doing? This is Ignacio, President of North Star Senior Advisors. Really quick about us, we are a senior placement company here in Central Florida. We've been here in business about 6 years. We help seniors and families locate assisted living and memory care options. It's a complimentary service. We've also started care management services here in Central Florida to help seniors and their families navigate through their care management needs. Today, I have with me Javier with AdventHealth Hospice Care here in Central Florida. So one of the things we decided to do, folks, is to have a series to discuss specific helpful topics around hospice. We think this is going to be very beneficial. Today, we will be discussing dementia and Alzheimer's specifically. But really quick, Javier, I'll give the floor over to you. You can introduce yourself and a little bit more about your company.
Well, thanks again, Ignacio, and thank you. Thanks again for having me here. Again, my name is Javier Melendez. I'm the Director of Business Development here at AdventHealth Hospice Care. AdventHealth Hospice Care, formerly Hospice of the Comforter, has been servicing the Central Florida area since 1990. We also have another program in the east side serving Volusia and Flagler. And so we cover 5 counties altogether. We're very excited to be here. And this dementia, Alzheimer's topic is very close and dear to my heart. My grandma actually passed from Alzheimer's disease. So educating the community in general about this topic, I believe it's very important.
Yeah, no, I couldn't agree more. And we see that a lot with placement as well. As a matter of fact, we really invested in our education. We're all certified dementia practitioners. We find it to be very helpful as we help families and seniors navigate through their needs around memory care. Part of what we do is pretty thorough assessment to make sure that they're appropriate for memory care. So I completely understand. Now, when it comes to dementia and Alzheimer's, maybe we could start with a quick definition. I know some folks may not be clinically inclined. So do you want to do that for us, Javier?
Sure. So what is dementia? So dementia truly is a group of symptoms, and that group of symptoms was considered a syndrome, right? And it's a group of symptoms that impact memory, they impact performance of daily activities of daily living, and your communication abilities. And actually, dementia is an umbrella term for all different types of dementia. There are many types of dementia. Alzheimer's is the most prevalent. About 60% of people that are diagnosed with dementia actually have Alzheimer's disease. But there are other types. There's Parkinson's dementia, there's vascular dementia, there is Lewy body dementia, and there's even mixed dementia, where a person may have dementia symptoms that stem from 2 or more types of different dementia, vascular dementia and Alzheimer's, for instance. So it is, at the end of the day, dementia is an umbrella term. Dementia really has become a very important subject in our community because as medical advances have actually helped us extend our life expectancies. For instance, in the 1960s, the life expectancy was around 69 years old, just shy of 70 years old. However, in the 2020s, our life expectancy is now closer to 80 years old, right? And as most symptoms of dementia don't start until after 60 years old, in the past, many people passed from other conditions, heart disease, pulmonary disease, etc. And no symptoms ever showed of dementia, or they suffered for a very small amount of time. They actually did not die of dementia. Now, as we live longer, more patients are actually developing and those signs and symptoms of dementia, and it's become much more prevalent in our community. So it's a great time a very important topic to have discussions around.
Yeah, again, I agree. And one thing that we find is, of course, there's different stages, right? So
Sure.
You get dementia, and now you're at at advanced stage. There could be, it's a progressive disease, right? So you could be at a very early stage and still be cognitively aware and intact to some degree. But unfortunately, it is one of those that does progress over time. So we do find that there are various stages to the dementia. And then, of course, how that person gets care at different stages is absolutely critical. The support structure that's there through those various stages is absolutely critical as well. So I agree completely. Now, a common question that's probably asked, Javier, is, is it normal? Is it part of the aging process, right? To get dementia or for dementia to be there? What are your thoughts around that?
So the answer to that is absolutely not. Dementia is not a part of normal aging. Dementia is truly a disease. Of course, as you age, it is appropriate, and it happens that where you may have some lapses, and things that happen. For instance, just to give you a couple of examples, as we age, it is normal for us to temporarily forget a name or where we left our keys. Hey, that happens to me all day, every day. But what is not normal is to have difficulty remembering familiar names, places, or even recent or important events, right? It's okay to forget, the day of the week every once in a while, or why you enter a room. You're thinking about 10,000 things, and you enter into a room and then you forgot why you actually went there, right? I know you're smiling because I know it happens to you. But what is not right is to get lost on your own street or forget where you are or how to get home. We all can make a mistake balancing a checkbook. We can make a math mistake, right? But what is not normal is to become completely befuddled, by familiar tasks like balancing a checkbook or following a recipe. And those could be very strong signs of dementia that's setting in. So it is important, when you have that inkling, either for yourself or for a loved one, to reach out to your physician and have those discussions so you can start getting screened for that.
Okay, great. Now, another common question may be specifically to hospice, right? So if there's a patient that has dementia, maybe regardless of the stage, is it an appropriate hospice patient? Is it somebody you can care for from a hospice perspective if dementia is involved or Alzheimer's?
Sure. And that is a common question. And unfortunately, as you mentioned earlier, for the most part, all dementias have a long disease progression, right? That's measured actually in years, not in months. So when a patient is appropriate for hospice care, the patient and the family have actually suffered for a long time from the effects of that disease. However, when it's finally appropriate, hospice is able to provide a unique proposition to that patient and the family. And it is to not only help relieve the caregiver's burden, right, of dealing, and the patient's burden of dealing with that disease, but also to help the patient age in place. That is to allow the patient to remain at home, wherever they call home, right? For many, the best course of action is to actually place our loved one in a assisted living facility or a nursing home, right? Hospice can then partner with that facility to become an extra set of hands, an extra set of eyes to help that patient remain in place, not having to move places, not having to keep going back and forth to the hospital, but to age in place. Make sure that they receive all the care they need and the dignity that's necessary, through the end of life, and not having to move, right? Now, when we're talking about when is a patient appropriate for hospice, specifically when it comes to Alzheimer's, all dementias have different disease progressions. But when it comes to Alzheimer's, which is the most common and possibly the easiest, quote unquote, to determine if a patient is appropriate for hospice or not, a patient may be appropriate for hospice if it's on an Alzheimer's patient. If, number one, the patient is incontinent of both bladder and bowel. Number two, the patient has lost meaningful communication, that is not able to have any meaningful communication, or the patient's ability to speak is now limited to 6 words or less in the course of a day or a conversation, or reduced to stereotypical phrases only, like, hey, good morning, hey, good morning, hey, good afternoon, right? And that's all they say over and over again. How are you, right? But not in a meaningful way. And also those two things, but also a recent history of other complications, like urinary infections, pneumonia, ulcers, and weight loss. So as you can imagine, as I describe it, it's very deep in the disease process when we're able to help. However, it's important to recognize that when a patient comes to us, our hospice doctors look at the patient as a whole. So it's not just, the patient's not just a diagnosis, it's not just Alzheimer's, it's not just vascular dementia. They look at the patient as a whole. So they consider all different or other comorbidities or other diagnoses the patient may have, all the whole environment of the patient, so they can go ahead and determine if the patient is appropriate for hospice. Bottom line is, if you feel that your loved one may benefit from our services, do not hesitate. Reach out. Make sure that we're able to have a conversation with you, evaluate the patient, and really ensure that the patient is appropriate for hospice or not. Worst case scenario, the patient is not appropriate for hospice services today. Well, we leave you with the tools and the information to understand when you can reach back to us. And we can always, put you on a schedule. Maybe in a month or so, we can follow up with you and we can reevaluate the case and see if the patient's appropriate for hospice at that time.
Yeah, no, that's extremely helpful. And one thing that you mentioned I want to touch on is, the ability to accommodate them in whatever environment they consider to be home, right? So, of course, that can be their individual home. For us, we represent the senior living industry, which is assisted living memory care. One of the things that we know that it's extremely helpful for hospice is to come in at that stage when they're ready and have them stay in place and receive that care and keep that dignity. Because one thing is, the last thing you would want is to shuffle different environments at that time. It's already a very, typically dramatic, stressful time. So the last thing you want to do is move to, let's say, a hospital setting, right? Because, you need that higher level of care. Hospice could come in and provide that and prevent that from happening. And I think that's a great benefit, in my opinion, when it's appropriate, of course. So that's one thing I just wanted to mention, because I know that's an extremely valuable piece of what you guys offer.
Yeah, I agree. And that is, again, it is one of the biggest benefits that hospice can provide, to help that patient and the family maintain their loved one, in their chosen place, in the environment that fits best for them. What better gift? What better gift?
Yeah, I agree. So folks, we're going to keep it a little short so that you can benefit from this information. We've done another video that Javier goes into more detail around hospice and appropriateness for hospice. So feel free to reference that. Javier, if you want to really quick share your information, and the folks that are watching, how they can reach AdventHealth Hospice, maybe your phone number, website.
Mm-hmm. Yeah, absolutely. Website planforhospice.com, planforhospice.com. It takes you straight to our website. If you would like to have a conversation with us, have your loved one evaluated, reach out at 407-682-9090, 407-682-9090.
Excellent. So folks, stay tuned. We'll plan on doing these about probably once a month, different topics, very beneficial topics, specifically around hospice and how service can benefit you, your loved one, a friend, neighbor. So stay tuned for additional topics here in the future. So Javier, thank you for taking the time. Happy holidays to you and your family. And I look forward to catching up again soon, okay?
Thanks, Ignacio, again for the opportunity, and happy holidays to you and your family as well.
All right. Thank you. Take care.
Bye. Have a good one.
Bye-bye.